Page 151 ATI Chapter 24, continuing with pulmonary embolism, therapeutic procedures would be an embolectomy, which is a surgical removal of embolus. Nursing actions would be to prepare the client for the procedure, which would include an NPO status and informed consent. Monitor post-op vital signs, SaO2, incision drainage, and pain management. A vena cava filter would be insertion of a filter in the vena cava to prevent further emboli from reaching the pulmonary vasculature. Nursing actions would be to prepare the client for the procedure, which would include NPO status and informed consent. Monitor post-op vital signs, SaO2, incision drainage, and pain management. Client education would include, if homebound, set up home care services, which would perform weekly blood draws. For severe dyspnea, set up referral services to supply portable oxygen. Follow recommendations for prevention of PE. If smoking, consider smoking cessation. Avoid long periods of immobility. Perform physical activities such as walking. Wear compression stockings to promote circulation. Avoid crossing the legs. If taking warfarin, do not increase or decrease the amount of vitamin K foods consumed, such as green leafy vegetables. Vitamin K can reduce the anticoagulant effects of warfarin. Adhere to a schedule for monitoring of PT and INR, and follow instructions regarding medication dosage adjustments if on warfarin, and get your regular blood draws. There is an increased risk for bruising and bleeding. Avoid taking aspirin products unless specified by the provider. Check the mouth and skin daily for bleeding and bruising. Use electric shavers and soft bristled toothbrushes. Avoid blowing the nose hard and gently apply pressure if nosebleeds occur. If traveling, take measures to prevent pulmonary embolism. Arise from a sitting position for 5 minutes out of every hour and wear support stockings. Remain hydrated by drinking plenty of water, and perform active range of motion exercises when sitting, such as ankle pump exercises. Complications of PE would be decreased cardiac output. Blood volume is decreased. Nursing actions for this would be to monitor for hypotension, tachycardia, cyanosis, and jugular venous distension, JVD, and syncope. Assess for the presence of an S3 or S4 heart sounds, which is murmurs. Initiate and maintain IV access. Monitor urinary output, which should be at least 30 milliliters per hour or more. Administer IV fluids, crystalloids, to replace vascular volume. Continuously monitor the ECG. Monitor for pulmonary pressures. IV fluids can contribute to pulmonary hypertension for clients who have right-sided heart failure, cor pulmonale. Administer inotropic agents such as milrinone, dobutamine, to increase myocardial contractility. Vasodilators can be needed if pulmonary artery pressure is high enough to interfere with the cardiac contractility. Another possible complication of PE is a hemorrhage. Risk for bleeding increases due to anticoagulant therapy. Nursing actions are to assess for bleeding from or bruising around injection and at surgical sites at least every 2 hours. Monitor cardiovascular status, such as blood pressure, heart rate, and rhythm. Monitor CBC, hemoglobin, hematocrit, platelets, and bleeding times, PT, APTT, and INR. Administer IV fluids and blood products as required. Test stool, urine, and emesis for occult blood. Monitor for internal bleeding, such as measuring abdominal girth, and check for abdominal or flank pain, at least every 8 hours. And have the antidote available for use if necessary. Remember, the antidotes are vitamin K for warfarin, protamine sulfate for warfarin, or for heparin, and for the newer anticoagulants would be plasma, fresh frozen plasma. Heparin is protamine sulfate.